Hi guys, Nina here with Therapy Cable, and I'm here today at Mariposa Women and Family Center with Sharzad Jalali, and she's the Community Counseling Program Manager, and she's going to give us a little tour around Mariposa and tell us what it's all about.
Hello Nina, welcome to Mariposa. It's wonderful to have you here. I'm going to go ahead and start the tour. Are you ready?
Yes, I'm ready.
To your right, we have our waiting room and our reception area. So once the clients come into Mariposa, this is where they're greeted and this is where they would wait for their counselors to come get them. On the board to my back, we have our weekly schedule. And then we have flyers on the tables that explain our programs. To my left, we have the wonderful receptionists, and this is where they greet the clients and sign them in and let the counselors know that the clients are here. We do provide them with free childcare. So as long as they let us know in advance, we make an appointment for someone from childcare to watch their kids while they're in individual or group therapy at Mariposa.
Nice room.
We have art supplies and the counselors work with the kids while they're in there, so it's nice.
Hi, my name is Sarah Rosario. I work here at Mariposa in the child care department. I've worked here for the past 5 years. This is a place where the kids are able to come while their parents are in therapy. It's a free service we provide here for the parents. So it gives them the opportunity, if they don't have anybody to watch their kids, they still are able to come here and get the support that they need. I also run our wraparound program here, which is our new program we just started with an hour of tutoring and then also an hour of process group for the kids. It just started about 5 months ago and we're having a great turnout so far.
We recently started a wraparound program, and what that means is a 2-hour program, an hour of psychotherapy and an hour of tutoring with their school stuff. So the kids come here and they're here for about 2 hours, depending on how many days a week they want to be here. And they get tutoring as well as therapy. So this is...
And where do you get these kids from? Do they come just from school, or is it different programs?
They're different referrals. Different
Okay.
referrals,
That
yes.
sounds good.
Every person that comes to Mariposa has to go through our intake department, and what happens there is they pretty much get their general information and they fill out the necessary forms. So once they're set up with an appropriate counselor, that way once they meet the counselor, they can just get started on the therapy process. We do have 3 different departments here. We have a substance abuse department, a community counseling program, and also our CalWorks program. So depending on what your needs are, you will be guided to one of the programs. And each program offers individual psychotherapy sessions as well as group therapy sessions, depending on what the client's needs are. This is some of the artwork that we're displaying here that has been created by our women's program, I believe, our women's substance abuse program. So they have a drug and alcohol education and relapse prevention classes in which, sometimes they do some kind of art therapy, and this is a sample of the work they've done. So I'm quickly going to walk you guys through the side of the building.
Okay.
As you know, Mariposa in Spanish means butterfly.
Okay.
So we had this wall painted in order to represent Mariposa to our
It's a nice
clients.
wall.
Yeah. So go ahead and take a look. This section is pretty much where all CalWorks offices are. So,
And can you explain a little bit of what CalWork is about?
Yes, I can give you like a general thing,
Yeah.
but I think it's because she works in it, it would be better. if she
Yeah,
does.
and I'm pretty new to CalWorks, so I don't know all the ins and outs, but it's basically people who are in welfare, and so it's a program for people who have some kind of mental disability or diagnosis, or just maybe having an extremely difficult time finding work due to past histories or current situations that make it difficult. And so it's a service provided that we can provide counseling for them. That's part of what they need to do in order to follow their plans for CalWorks to get cash aid and those kind of things.
Hi, my name is Shanda Krosick. I'm an MFT intern, Marriage and Family Therapist intern, and I'm the case manager and the intake coordinator here for Mariposa's CalWorks program. We help serve women with minor children who are on the Welfare to Work program, and my job as case manager is I set the initial appointments and meet with them for a couple times after that, just to kind of help with rehab services and coaching skills, other work-related activities like job placement services. And I do the assessment and just the initial services for the CalWorks program. Then we go ahead and get them scheduled with their counselors so they can see somebody on a continual basis. To be qualified for CalWorks, you have to have at least one minor child and be enrolled with social services for the Welfare to Work program. It's something they have to be qualified for through a social worker. And we provide behavioral health services here, obviously at Mariposa. Within the CalWorks program, there are other welfare to work activities that the clients participate in, but behavioral health is voluntary, so we do our best to help them with their mental health needs.
So how long are the clients in therapy for usually?
It depends on how long their welfare to work when they started the program. It is, I believe, a 48-month program, so about 2 years, depending on when they started and what services they've utilized. For counseling, typically I would say clients are here from maybe 3 months to a year on average. Just really depends on the person and what services they're looking for. My experience at Mariposa has been wonderful. I started out as a trainee here while I was in graduate school in the community counseling program, seeing roughly 10 to 12 clients a week, and then I transitioned over here to CalWorks and learned a lot of new great skills doing case management and assessment, and I just really love it. It's a really great environment, very good reputation, very collaborative team, so I've had a wonderful experience.
I just want to walk you guys through a sample therapy room. This is what a typical therapy room looks like at Mariposa. So the counselors get the clients from the waiting area and they bring them back here, and they're in here for an hour or so, whatever the time of therapy might be, and then they walk them out.
So how many counselors do you guys have at Mariposa?
Well, it differs depending on the different programs, what they're offering, how many groups we're running. But right now, I would say we have about 40-50 counselors working at Mariposa.
Wow. Okay.
Yeah, we attend to more than 50 clients a day.
Okay.
So technically, we need to have the counselors to be able to see the
definitely.
clients. So in addition to having individual therapy at Mariposa, we also offer all sorts of group therapies. And a typical group therapy room looks like this. So the clients come in, they sit in a process format like this, and their counselor joins them. Sometimes they have a co-counselor, and they pretty much run the group. So it's a very friendly atmosphere.
Okay. And how many people are usually in a group?
It depends. Some of our groups are larger, but for the most part, I would say 5 or 6. In addition to our interns who are not yet licensed, we also have some licensed professionals here at Mariposa. So if a client prefers to see a licensed clinician, they can ask for them from the beginning. We do work on a sliding scale, so depending on your income, the finance department will give you a quote that's most suitable to your income.
My name is Dr. Krista Driver, and I am the CEO of Mariposa Women and Family Center. And Mariposa has been around for about 37 years, and it started as a substance abuse program for women, and it has just grown and grown over those 37 years to now we serve over 3,000 women, children and men here and across all 3 programs. We're located in Orange and also in San Juan Capistrano. Mariposa is a nonprofit. We are a fee-for-service agency. In order to keep our fees low for our women and children that we serve, we do depend highly on grants and donations to supplement that revenue. And so part of my job is to seek out donors or seek out people that would have a passion for the work that we do and help us financially and in other ways to keep our agency viable and allow us to continue to offer services to people that would not otherwise be able to afford that. In our programs, we offer many services to women who are high risk, and those include domestic violence, survivor of sexual assault, anger management, parenting classes, and just a whole plethora of services for a variety of challenges that these women face. We do offer free childcare because oftentimes that is a barrier for a woman getting services, so we offer that here on site.
My name is Sharza Jalali. I am the clinical program manager for the community counseling program here at Mariposa Women and Family Center, where we serve over 50 clients daily. The clients come to us with different presenting problems, and depending on the presenting issue, we set them up with the appropriate counselor who can help them overcome the presenting problems. The clients usually go through the intake department once they come in. That's where they get assigned to the appropriate counselor, and then from then on the clients meet with the counselor on a weekly or bi-weekly basis depending on the needs, and when they meet their therapeutic goals, they're discharged from the program. In order to participate in the community counseling program, there are no particular requirements except that we do work on a sliding scale, and clients are responsible to pay their fee every time they meet with the counselor, whether it's in individual or group format. My experience here at Mariposa has been wonderful. It gives me great pleasure to know that we are actually reaching out to the community and helping people out there and providing them with the services that they may need. It's my experience that a majority of the people out there do require psychotherapeutic services, however they cannot afford it. That's why nonprofit organizations like Mariposa, and there are a lot of other ones out there, are very helpful to the community, and it provides people with an opportunity to get the services they need at a low cost.
In our CCP program, we have about 50 counselors, and they're all volunteer. They're here doing their hours towards their licensing, whether it be as an MFT or an MSW, or we have PsyD students as well. And in addition to those volunteer counselors, we have 3 licensed therapists on staff, so we can provide a whole spectrum of services.
Hi, I'm Sarah Owen. I am the clinical program manager of Mariposa's Women and Family Center Substance Abuse Treatment Program. One of the most unique parts of our program is that we work within the community with various shelters and other outside agencies to have women of all different types in our program. It is 16 weeks long. The women are required to do a drug and alcohol education class as well as a relapse prevention program. They also receive process groups and support groups as well as individualized therapy sessions throughout the month. I think one of the strongest parts of our program is the fact that we are able to operate from an AA basis. We don't do a lot of the same exact parts of it, but we do take bits and pieces of it. One of the parts of that is the assignments that the women are given throughout the 16 weeks. We do a variety of assignments, the 20 consequences of your behavior, 10 dishonest behaviors. We do hurts and resentments, we do forgivenesses, loves and appreciations. These are all programs and assignments that the women can work on individually or with their family members. That's another unique piece of our program, is that we have allowed the women to begin to understand how addiction is a family systems issue. And although we could take a client in and take care of them on the clinical care level, get them all ready to face the world as a sober individual, it's important that we begin to understand that it is a family systems issue, and these women are going to go back into the world and have to continue to live with the people that knew them before when they were in their addictive behaviors. So we've begun to really establish a stronger connection with the family. We've developed a Friends and Family of Addicts program, where upon intake we assess the family members and we allow them to have that space to talk about the things that are going on in their lives, some of the issues that they might be struggling with or the challenges they might be facing dealing with their loved one as they struggle through this issue of addiction. I've had a great experience here. I started here actually as a trainee during my practicum site. I was brought right on with Dr. Driver as my supervisor, program director, and was basically thrown right into groups, which was really beneficial for me educationally as well as my own involvement as a therapist. I suddenly just learned how much I can relate to this demographic and how much there's such a need for people who have a passion towards helping women to work in the substance abuse field. I was at that point I became the clinical program manager, so I was able to kind of help oversee the program and grow the program. Since we are county funded, we have to always be thinking of other groups that could benefit the community. We started, like I said, the Friends and Family program. We also started a program called the Life Skills Group, which is basically working with transitional age youth. They're learning things that can kind of help them get a better understanding of how to function in their day-to-day lives. So we do things like resume building, working with nutritionists, working with people trying to get them better jobs, how to interview, various things like that, just basic life skills. We've also developed a drug diversion program for adolescent, as well as an adolescent outpatient program that is in the works.
In our substance abuse program is where we really see a lot of major changes in our women. They may come in actively using, and then over the course of treatment establish some sobriety. So we see a lot of success stories in there, just in that they get off of drugs and alcohol and maybe get their children back that were in foster care or a variety of other placements. And we hear a lot of women talk about their lives being transformed while they're here, and that's really the reason that we continue to do the work that we do.